Okay, everybody's been asking me about the progression for stretching out the chest area, particularly if somebody has breast implants from mastectomy reconstruction or is just simply recovering from a mastectomy and an axillary node dissection. So I'm going to sit on this mini tramp, but this could be the floor, a chair, whatever. And I'm going to start off simply placing my arms by my side and sticking my chest out, head in alignment, and I'm doing an isometric back contraction, which is giving me a very slight stretch across my chest, which for a lot of people recovering from surgery is all they can handle. So I would go ahead and have your clients start with this, focus on deep breathing, and hold that for 20 to 30 seconds. And if they do this and they say, I don't feel anything, then let's go on to the next one, which is going to be placing their hands behind their head and telling them to push their elbows back and squeeze their shoulder blades together. Okay, there should be no pain. They should feel the contraction in the middle of their back and feel a gentle stretch across their chest. Hold it for 20 to 30 seconds, focusing on breathing. Now, if that's too much for them, then I'm going to have them go back to this. But if they're ready to go on to the next step, then I'll go ahead and I'll have them lie down, not on a mini tramp, but this works. And we want to start off with range of motion. So if this is the capacity for their range of motion right now, then just work within this and tell them to breathe into it. Trying to expand that range of motion until they can get all the way out here and feel that nice stretch. They can hold that there for 20 to 30 seconds. And then at this point, when they have full range of motion, you can begin to use a load. Now, I'm going to show you both with dumbbells and with the band. I have 10 pounds. I would not give this to my clients. I would start them with 1 pound, then 2 pounds, then 3 pounds, so on and so forth, because we also don't know what their body can stand if they've had lymph nodes removed or irradiated. So let me repeat this. Pretend this is a 1 and not a 10. This just happens to be what I have here. Do bear in mind that somebody should be at least 8 weeks out of mastectomy or implant placement before they begin even doing the full range of motion without resistance, because we don't want to do any damage to that surgical incision in the healing process. So I always start by raising the weights up above my chest, and then nice big stretch here, pulling from my armpits is how I describe it to my clients. Loose grip on the weights, just enough to hold it, but getting that full range of motion. Keeping my abs nice and tight, of course. And if at any point they say it's painful, then stop and go back to just range of motion with no weight. Then when they're done, always have them bring it in, set one weight down and then the other. And then let me just show you doing this with the band. So, of course, you have to have a post or something stable so you don't end up falling on your face or pulling over your furniture. Now, I'm using a blue band, but I would start somebody with the lightest, whether it's yellow or green or whatever, and progress towards it. This is a great opportunity also to engage the core. Bring in the arms straight out here. Let them go back. They should be in control, not doing this type of thing. So, slow and controlled coming out, and then pulling from the armpits, tightening up the pec minor. And working the pec minor actually stimulates lymphatic flow, which is an added bonus. Slowly letting it go back, then engage those muscles. Nice and easy. Okay, now, while you could have your clients do presses, I would resist that at least until they have nice, perfect posture. Shoulders are back, palms are facing their body. They're not showing signs of round shoulder syndrome. And check with their doctor, because some breast surgeons will say absolutely no presses, chest presses, and no pulling, which would be rows. So last little warning, bit of advice, if somebody has expanders in place absolutely no chest exercises, which means no back either. So no concentric or eccentric chest movements, but they can do isometrics.